Hey guys, it's JP, and this time I'm going to talk about some important things to look for during the second phase of the running cycle, which is most notably known as the mid-stance phase. Last week I talked about the first phase, initial contact, which is where the foot landing occurs. Now, I believe this is an important topic to go over as I believe runners and coaches should be more aware of running mechanics that occur after the foot landing. This is because people tend to focus only on assessing the first phase of the running cycle, which is where the foot initially makes contact with the ground. This is why the most commonly talked about things in running are the type of foot strike the person presents with, as well as whether or not they are overstriding. However, we need to look past this phase. This is why we'll be going over the mid-stance phase of running. This basically takes place midway between when the foot lands and leaves the ground. It may not seem like much is going on here, but if you are measuring vertical ground reaction force, this is actually where the highest magnitude peak takes place. During this specific time, the body basically coordinates in a way so that energy is being absorbed and stored in the muscles and tendons. This is important as this helps improve efficiency as you run. Now, one thing I look for during mid-stance is pelvic position. It is important to remember that the pelvis may not always be even, as there will naturally be slight dynamic tilting of the pelvis to each side. However, during this specific phase, I try to observe for increased contralateral hip dropping. This means that the opposite hip of the leg that is in mid-stance is dropped or in a lower position. This causes the hip of the grounded leg to tilt inward. Now, you may be asking yourself, why does this occur? Many people quickly attribute this to weakness of the hip abductors. However, that is not actually always the case based on recent research. Rather, it may be a combination of that and how the muscles around the hip actually coordinate and work together. However, it is something that should be addressed. This is because excessive pelvic movement may lead to decreased efficiency as you run. If the lateral muscles of the hip, most notably the gluteus medius, could coordinate and work in a way where there is increased stability and less dropping of the hip, this may optimize force distributed through the leg and lead to improved force output, and ultimately leading to better times. Knee position is another thing you can look at during the mid-stance phase. You can actually look at it in two views as they both give essential information. From the front or back view, you can observe if the knees are coming in or out, otherwise known as knee valgus or varus, respectively. When the knees look like they are trying to kiss, this is more appropriately known as knee valgus. It is the more common running form deviation you may see. Similar to contralateral hip drop, this can clue in on insufficient hip abduction strength and possibly coordination and control of the muscles around that region. Now, it is also important to take a look at this from a side view as well. From here, you can also observe how much knee bend occurs. Based on standard running assessments, people tend to look for the knee to flex or bend around 45 degrees. However, it can vary due to multiple factors. One example is relative speed, as when one moves towards sprinting, there is typically less knee bend that occurs. Now, a third thing to look at is step width. This refers to how far the foot is from the middle of the body from a front or back view. When measuring distance of the foot placement to midline of the body, this is usually close to 0. Now, the deviation I may try to correct in a runner is when there is a negative value, which is basically when the foot is crossing over the midline of the body. People tend to refer to this as crossover gait. Having crossover may increase stress on the side of the knee, most notably the iliotibial band, or IT band for short. It may possibly contribute to knee pain. Applying this clinically, cueing a runner to increase step width may help decrease symptoms of pain on the side of the knee. And those are just a few things you can look for during the mid-stance phase of running. I hope you guys are finding the run assessment series helpful in understanding running mechanics and what to look for. I'd love to hear your thoughts and any questions you may have. And as always, thank you for watching.